Hello, everyone. This is Elijah Shabazz, the veterinary technician, here again to talk about pet awareness to increase the quality of life in our pets. Today, we'll discuss outdoor activities in the summertime with our pets and some concerns we need to be conscientious about, like heat stroke. Heat stroke can be inflicted on our pets doing daily activities in hot, humid environments. Brachycephalic dogs are more susceptible. That's dogs and cats with smushed in faces because the anatomy of the airway, their breathing is compromised, and they pant more to cool themselves down. Clinical signs for heat stroke can be excessive panting, drooling, excessive drooling, vomiting, diarrhea, weakness, collapse. Your pet can even experience a seizure. If your pet ever have a seizure, please remove any objects in the area that can inflict bodily harm to your pet, and never place your hand in the pet's mouth. Dogs do commonly bite their tongue, but that's the least concern. The most concerning symptom caused by heat stroke in our pets is something called DIC, disseminating intravascular coagulopathy. It's a blood coagulation disorder that is inflicted by heat stroke shock that causes the vascular anatomy of our pets to exhaust their clotting factors and platelets. These two things are important to maintain normal blood flow. Thus, with the exhaustion of platelets and clotting factors, our pets can go into internal bleeding, which is a life-threatening situation. It's very complicated health issue that's difficult to get in order once that happens. The clinical signs for DIC is bruising of the gum line, bruising in the ear, and bruising on the underbelly. Moving forward, leptospirosis. Leptospirosis is a bacterial virus spread through wildlife, particularly urine, wildlife body secretions. Um, Wildlife can go and urinate in a stagnant puddle of water. Our dogs can track through it, later lick their paws, or our dogs can simply lick up some of the stagnant water during that hot summer walk. That's why I always express have ample amount of cold water during these walks because so many dangers unseen to our eyes that can cause unhealthiness for our pets. Leptospirosis affects the kidneys and liver of our pets and also affects the red blood cell population of our pets. Um, Clinical signs is severe lethargy, vomiting, diarrhea, and impotence, bloody diarrhea, as well as bloody vomiting, yellowing of our pets, white of the eyes, the gums, ear pinna, because it affects on the liver. Our pets can go into a bleeding disorder where the red blood cells are destroying themselves, which is called immune-mediated hemolytic anemia. So yes, these are serious things. For the leptospirosis, you can get a lepto vaccine administered for your pet at your general practitioner. Treatment, it's intravenous fluids. It can include blood products, broad spectrum antibiotics, and stomach protectants, if I didn't say that already. Um, Moving on, insects can cause some issues for our pets. The mosquito can pass heartworms to our pets through the bite. They can pass a microfilia larva, which takes some time to migrate through the body tissue of our pets, entering the vascular system of the pet and migrating through the vena cava of the pet and residing in the right side heart of our pets, which can obstruct blood flow, cause coughing, inability to exercise, weakness, inappetence, swelling of joints. So it's very important to provide your pet with the heartworm preventative that you can purchase from your regular veterinarian. Mosquitoes, flies. Flies can be a problem. They can inflict what's called fly strike on an ungroomed or unkept pets that's exposed to the outside for a long period of time. They can lay the eggs, which can then develop into maggots and causing a maggot, yes, a maggot infestation, which is one of my pet peeves in this field. It's one of the only cases that give me skeevies when treating. But moving forward, the maggot infestation clinical signs are the foul odor, discomfort in your pet, your pet's annoyed, and you'll see a pet gnawing at a particular area trying to soothe the area. It's usually treated with broad spectrum antibiotics. It's a long healing process because it causes severe tissue damage. So just try to keep your pet well groomed and cleaned, particularly on the hind end, because even the smallest amount of fecal debris can attract flies and cause this to happen. Next is the ticks. The ticks can pass Lyme-borne diseases to our pets, causing severe pain, lameness, in severe cases, inappetence. Tick-borne diseases can also cause kidney problems in severe cases, and also IMHA also. There is a vaccine available, again, at your general practitioner. You can speak to your general practitioner about that. Treatment includes broad spectrum, long-term antibiotics that's given orally for your pet. Bee stings or other insect bites or stings can cause allergic reactions in our pets. An allergic reaction is onset, swelling of the face, hives, redness of the skin. It's very uncomfortable. Your pet's very itchy and discomfort. It requires intravenous antihistamines and steroids to help alleviate these symptoms in our pets. If your pet ever experiencing this episode, see your veterinarian or an emergency veterinary service right away. Anaphylactic shock can be caused by insect bites too. Unlike your allergic reaction, there are no clinical signs except that your pet is all of a sudden limp as you seem out of it. Like, if that occurs, immediately seek veterinary assistance. You have ear infections, which is increased during the summertime. Pets like to swim. That can increase the chances of bacteria inside the ear and causing ear infection. Because it's hot and humid out, the dog's ear is like a pendulous that covers the ear canal and obstructs the flow of air into the canal, thus turning the ear canal to an incubator for bacteria. Clinical signs for ear infection is reluctant to be pet, head tilt, scratching at the ear, rubbing the ear on the ground, red ear. You might even sense a bad odor coming from your pet's ear. I want to add increased shaking of the head can cause something called an oval hematoma in your pet, which is a burst vessel in the ear pinna, the inside flap of the ear. And all of this is the air between the skin and cartilage filling up with blood. It can be surgically repaired or therapeutically repaired. Also, your pet can get a deep ear infection too from chronic ear infection, untreated for chronic ear infection, and that can cause more complicated problems The inner ear is responsible for equilibrium in our pets, and that can cause your pet to be unstable and mobile. They can develop nystagmus, rapid side-to-side rotation of the eye, which makes them very dizzy and nauseous. You might see some vomiting with that. The best way to um, maintain the ears is to keep them clean with flush, keep the ears clear of hair. The treatment is usually topical ear medications. Veterinary services even have a 1 week ear medication that's used for pets that intolerate their ears being handled. Um, a good tip to do is maintain the ears. You can buy over-the-counter flush and uh, intermittently clean your pet's ears maybe once a month, or have the groomer do it when they have a grooming appointment. Just ask the groomer to clean the ears, clear the ears of hair. Most groomers are compliant with doing that. Then you have kennel cough, which is like a common cough in pets. It's an infection of the tracheobronchial anatomy in the dog. Um, it's contact to just regular activity without pets. They go into dog parks, doggy day camps, regular parks in the neighborhood, socializing with dogs. Shelter dogs contacted regularly. Clinical signs for that is coughing, nasal, eye discharge. Untreated kennel cough can turn into a bacterial fungal pneumonia. And they have a vaccine for that too, the Bordetella. And boarding facilities and doggy day camps require your pet have this vaccine to prevent the spread of kennel cough. Um, the treatment it generally is antibiotics, and it can be an antitussant, anti-cough drug to comfort your pet if they're having a coughing episode. Lastly, if you keep your dog outside in the yard for long periods of time, or you have them living out there in the summertime and you live in a wooded area and wildlife is around, you want to be concerned about bite wounds. Or if you're on a farm, your dog running into objects causing lacerations. These things can become infected, causing sepsis. Um, the bite wound is deceiving to the eye because all we see is the puncture. It's something called the iceberg effect, where because the canine goes in deep, it does damage to the tissue and muscle area wherever it was bit, which can develop to an abscess. For most bite wounds, surgical procedure is recommended where the veterinarian will place pinroll drains. It's very important for at-home care to keep high maintenance on the pinroll drains so they can do their purpose by draining that infectious fluid out of the affected area of the pet, thus alleviating the chance of your pet developing an abscess, which can turn into a very nasty wound to have to manage. Um, and that's it, folks, for today. Until next time, beat the heat by giving your pet an ice cold treat. Have a good evening.